Have you ever pondered why some people behave in ways that are drastically different from the norm and seemingly out of their control? This enigma that we're about to unravel is the world of personality disorders. These aren't just momentary moods or fleeting behaviors, but deeply ingrained patterns that deviate significantly from societal expectations. They're not occasional detours in behavior. They're more like permanent residences in the realm of the unusual. Personality disorders are complex, making them difficult to spot and even harder to treat. They can be like intricate mazes, confounding those who try to navigate them. Yet they're also a part of our human diversity, adding different colors and shades to the human personality palette. Diving into the world of personality disorders is like opening Pandora's box. It's complex, intriguing, and sometimes a little scary. But knowledge is power, and understanding these disorders can help us show empathy and support to those who live with them. Just as there are countless personalities, there are numerous personality disorders, each with its unique set of symptoms. Let's start with paranoid personality disorder, characterized by pervasive distrust and suspicion towards others. Then, we have schizoid personality disorder, where individuals may seem detached and display little emotion. Schizotypal personality disorder, on the other hand, is marked by eccentric behavior and unusual thinking. Moving on, antisocial personality disorder is known for a disregard for others' rights, while borderline personality disorder presents with intense emotional instability. Histrionic personality disorder manifests as excessive emotionality and attention-seeking behavior, whereas narcissistic personality disorder is characterized by an inflated sense of self-importance. Avoidant personality disorder leads to social inhibition due to feelings of inadequacy, and dependent personality disorder is marked by a pervasive psychological dependence on others. Lastly, obsessive-compulsive disorder, not to be confused with OCD, is typified by preoccupation with orderliness and perfection. As you can see, the spectrum of personality disorders is vast, making it challenging to pinpoint or categorize one's behaviors accurately. A diagnosis of a personality disorder is not a life sentence. It's a stepping stone towards understanding and managing one's behavior. Determining the presence of a personality disorder is a delicate process. It requires a comprehensive psychological evaluation, often involving interviews and questionnaires, to assess an individual's long-term patterns of thinking, functioning, and behaving. The criteria outlined in the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, serves as a guide for professionals in identifying these disorders. However, the road to diagnosis can be fraught with challenges. Personality disorders often coexist with other mental health conditions, making them difficult to pinpoint. Moreover, their symptoms can be easily misunderstood or overlooked, as they often manifest as traits that seem integral to a person's identity. Once a diagnosis is confirmed, the journey towards treatment begins. This journey is far from linear, as the treatment for personality disorders is as diverse as the disorders themselves. Psychotherapy, or talk therapy, is the cornerstone of treatment. It helps individuals understand their thoughts and behaviors, develop coping mechanisms, and improve their relationships. Medications, though not a cure, can help manage specific symptoms or co-occurring conditions. Lifestyle changes, such as regular exercise and a healthy diet, can also play a significant role in managing symptoms and promoting overall well-being. While there's no one-size-fits-all treatment for personality disorders, the key lies in individualized and comprehensive care. Having a personality disorder doesn't mean that one can't lead a fulfilling life. It's about understanding the nuances and learning to navigate the complexities of these conditions. It's about fostering resilience and embracing self-acceptance. Living with a personality disorder may be challenging, but it's not insurmountable. The right support system, a combination of professional help, therapeutic interventions, and a nurturing environment, can make a world of difference. Cognitive behavioral therapy, dialectical behavior therapy, and other forms of treatments can help individuals manage their symptoms effectively. And let's not forget the role of empathy and compassion. The journey can be less daunting when one feels understood, accepted, and loved. It's about breaking down the walls of stigma and creating a safe space for dialogue, for growth, and for healing. Remember, understanding is the first step to acceptance, and only with acceptance can there be recovery or progress. So let's strive to understand more about personality disorders and foster a compassionate society.